I was a normal, healthy 12-year-old. I played a ton of sports. I was a cheerleader, I was a dancer, and just one day in August, I was running in my front yard, and I somehow got myself in the house, opened the door, and fell dead at my mom's feet. That was our first sign that anything was wrong. When Noah, my second son, was about a year old, his EKG changed drastically and became worse than mine. We got a diagnosis of hypertrophic cardiomyopathy.
I was diagnosed with dilated cardiomyopathy in my 30s. Knowing that I had heart disease, that my dad had heart disease, my grandfather had heart disease, I just wanted to make sure the kids were okay. So I called Children's, and they actually found that Tony had LV&C.
There really wasn't a program dedicated to advanced heart failure and cardiomyopathy here at Cincinnati Children's. We really grew it from a bare bones, non-existent sort of a program to probably the largest outpatient experience in North America currently. So we follow somewhere between 5,000 and 6,000 patients. The thing that's unique about our program is that I'm both an adult cardiologist and a pediatric cardiologist. So we see patients of all ages, which is important because the kind of heart disease we're dealing with is more of a heritable type of heart muscle disease. So things that can run in families, for example. And so it gives us the opportunity to see multiple generations at one time.
I believe, having been around the country and many other institutions, where my colleagues also have research laboratories, that we have something very unique here at Cincinnati Children's Hospital. We try to investigate childhood diseases at the genetic level and find new ways of treating them. And many of the ideas that are spurred here in the research laboratories directly lead to clinical trials. I've gone to Dr. Jeffries, and we have thought of a way to set up a clinical trial with an investigational drug that appears to be perfect for the disease that we believe unfolds in the heart during muscular dystrophy in children.
A lot of people that are interested in piloting new innovative therapies come to us because they know we have these patient volumes. And so it gives patients access to these cutting-edge therapies, which is pretty exciting. Our experience is that patients that are managed appropriately, that have the right kind of follow-up, that have the appropriate restrictions in place, do exceedingly well. And we're very proud of the fact that our patients have very good outcome.
With hypertrophic cardiomyopathy, a lot of times the first symptom is sudden cardiac arrest, which it was in my case. But if you're followed by a physician and you follow their guidelines, really the chance of death is the same as the general population. So, for Noah, he's not allowed to play competitive sports, he's not allowed to have any caffeine or stimulants, and he's on a beta blocker. And so doing that, he should have a pretty normal, healthy life.
Our goal for every patient and their families is to allow that individual to live a long and fruitful life with the heart that they were born with.
We're lifelong patients here. Being able to come here and see familiar faces and seeing smiles and seeing people that care about us and our family so much, it makes such a difference. It's really cool to be a part of a hospital where you feel like that. We don't think there's any better hospital for heart care.